Thank you for joining us for our part one of our four-part series for Medicare 101, Everything You Never Wanted to Know. This week, we're going to do Medicare Part 1, Eligibility and Coverage. So we're going to talk about how to enroll in Medicare, how to become eligible for Medicare, the costs, and what benefits are provided. I am with the Pikes Peak Area Council of Governments Area Agency on Aging. And the mission of the Area Agency on Aging is to work with our partner communities, and this includes a 3-county region of Park, El Paso, and Teller counties, to work with their communities to develop systems and programs that allow people to stay in the community and in their home for as long as possible, and to advocate for those needs. This is in partnership with the Pikes Peak Library District. We've partnered with the Pikes Peak Library District for several years now, and we greatly appreciate that partnership. Hopefully you learned about this presentation through that partnership. My name is Roma. I am with, again, the Area Agency on Aging in Colorado Springs, and I am the coordinator for the SHIP program within the Area Agency on Aging. The SHIP program, or State Health Insurance Program, is a federally funded program that provides free, unbiased information, education, and advocacy on all things Medicare. Again, this is a federal nationwide program. Every county in every state has access to a SHIP counselor, if nothing else by statewide toll-free number. This program is designed to provide, again, education about Medicare in any way, shape, or form, as well as advocacy and assistance with particular parts of Medicare, with claims, appeals. We assist with low-income applications for these programs as well. The SHIP office out of this Area Agency on Aging actually covers a total of 9 counties in Colorado. Tonight, we are going to talk about Medicare Part A and Medicare Part B, also known or referred to as Original Medicare. In week 2, we're going to talk about Medicare, what sometimes is referred to as Medicare Part C, also known as Medicare Advantage plans, and Medigap. In week 3, we're going to cover Medicare Part D, the prescription drug benefit. And in week 4, we're going to cover how Medicare coordinates with other types of health insurance, such as employer coverage, etc. But again, tonight we're going to cover Original Medicare, Medicare A and B, and we're going to start with who runs Medicare. There are 2 parts to that question, or to that answer. Social Security, or the Social Security Administration, is the agency that determines who becomes eligible for Medicare. They are also the entity that enrolls people in Medicare, and they are the entity that collects the premium that most people pay for Medicare. Social Security does have regional offices, and I've listed our local office here in Colorado Springs for our 3-county region. Social Security provides your Original Medicare card. Again, they enroll you in Medicare. They determine who's eligible. You can contact them by toll-free number, which is a nationwide number, available Monday through Friday from 7 a.m. to 7 p.m. in all time zones. You can contact them through their website, ssa.gov, or you can go to local office. Once someone is determined to be eligible and enrolled in Medicare, then Social Security wants nothing to do with Medicare. And any questions you may have regarding your benefits once you're enrolled would be directed to the Centers for Medicare and Medicaid Services, also known as CMS, but most commonly referred to as simply Medicare. Medicare is who processes claims. They determine what benefits are available. They administer the program and the benefits. They pay the providers directly. Medicare does not have a brick and mortar location. The only way you can contact Medicare directly is by their nationwide toll-free number, 1-800-MEDICARE, or you can go to their website, medicare.gov, 24 hours a day. The toll-free number is also 24 hours a day, 7 days a week, 365 days a year. But again, Medicare itself does not have local brick and mortar locations. Who can have Medicare? Basically, any U.S. citizen that has become or is becoming age 65 or older and has contributed into the tax system through payroll taxes is eligible automatically for Medicare at 65 or older. Other ways to become eligible for Medicare, and this is at any age, is if you are determined to be disabled. So you apply for disability through Social Security and you are approved for disability through Social Security, you become eligible for Medicare at any age. If you are diagnosed with end-stage renal disease or kidney failure and are receiving kidney dialysis, you can become eligible automatically and almost immediately for Medicare at any age. If you're diagnosed with Lou Gehrig's disease or ALS, you can become Medicare eligible at any age. And then any lawfully admitted resident alien who has resided in this country for at least 5 consecutive years and is becoming age 65 is eligible to purchase Medicare. So when should you enroll in Medicare? Well, these days, more and more people are working past their eligibility age of 65. But you do need to be aware of an enrollment period that surrounds that eligibility age of 65 for most people. And that's called your initial enrollment period. The initial enrollment period is a 7-month window that surrounds the month of your 65th birthday. So it begins 3 months prior to the month of your 65th birthday, includes the month of your 65th birthday, and up to 3 months after the month of your 65th birthday. That is your initial enrollment period to enroll in Medicare without penalty or delay. There are other times potentially you could enroll depending on your situation, and we're going to talk about that next. If you don't enroll during your initial enrollment period, there could potentially be some penalties down the road. But again, we're going to cover that next. So other enrollment periods that you could fall under, a special enrollment period. A special enrollment period applies to people who are still actively employed and have employer health coverage through that current employment. That is literally the only excuse Social Security will accept for not enrolling when you first become eligible at age 65. What that means is you can delay enrollment into Medicare while you're still actively working with employer coverage through that work in favor of using that employer health coverage. Once you quit working, you have actually an extended amount of time to enroll in Medicare without penalty. You get 8 months from the time your employment ends to enroll in Medicare at any time. If you do not enroll in Medicare during the initial enrollment period, you don't fall under a special enrollment period. You can enroll any year down the road during the general election period. The general election period every year is January 1st through March 31st. If you enroll during that period because you missed your other 2 opportunities, your coverage will begin the first day of the following month that you enroll, but you will be looking at potential penalties for not having enrolled under one of the other 2 opportunities. So this is what the Medicare card looks like these days. It will simply have your name. It'll have your Medicare ID number, which is simply a random series of letters and numbers, and it will indicate when your Medicare Part A and your Medicare Part B go into effect, and that's all it will ever indicate. I typically refer to it as the red, white, and blue card, or just simply the Medicare card. Couple of tips on becoming eligible and enrolled in Medicare. First thing you might want to do is make sure that your contact information and your mailing address is up to date at Social Security. Because Social Security is responsible for enrolling you in Medicare and sending you your original Medicare card, they need to make sure that you have your current address on file. If they don't have your current contact address on file, they're still going to send the card without knowing better, and that card could be sent to somebody who shouldn't have it. So make sure your contact information is up to date. And just a note of caution, be aware or be wary of anybody who may try and contact you to verify or confirm that you've received a Medicare card. And I say that simply because Social Security is never going to call you or text you or email you to confirm whether or not you've received your card. They simply don't do that. Neither does Medicare. Medicare will not contact you to verify that either. So if anybody is trying to contact you to verify your Medicare card has been received, or to verify that that you've got the card by getting your Medicare number, that should be a huge red flag for you, and simply don't give them that information. In the email that I sent out prior to today's presentation, I did include a handout, a couple of handouts from Social Security. This one gives you a list of all the different types of things that you can do on the socialsecurity.gov website, or ssa.gov. Social Security also does strongly encourage you to create a personalized account on the Social Security website. I don't know if anybody has ever tried to contact Social Security recently, either by phone or by going to the local office, but it can be frustrating. Social Security is encouraging more and more that people go to their website and contact them through a personalized account. Creating a personalized account on the Social Security website is not required by any means, but it is strongly encouraged. You can apply for Medicare online through that account, but you can also apply for Medicare through that Social Security website without an account. Having an account does have its advantages. It provides you with the ability to get real-time income quotes, potential income quotes, monthly quotes. You can see the status of any inquiry you have into Social Security. You can apply for Medicare and income benefits, and you can print temporary Medicare ID card through that personalized account as well. The other handout that I included in the email that I sent was how to create a personalized Social Security account. It is very secure because it's Social Security, obviously, but it is also relatively easy to set up. Again, it's strongly encouraged, but not required. I also included a handout on how to create a personalized Medicare account at the Medicare.gov website. This is also strongly encouraged, but not required. And of course, there are benefits to having an account with the Medicare website once you're enrolled in Medicare. You do have to have a Medicare number to create a Medicare account. But if you have that account, it allows you to see any claims that providers have submitted for services that you received from them in real time. It provides the option to save a list of any medications that you've been prescribed. It provides a personal electronic health record option, if that is something that you are interested in receiving or using. Again, very secure, really easy to set up, strongly encouraged to create, but again, not required. Any questions about any of that so far? Again, if you have a question, you can simply unmute and ask, or type it into the chat. All right, I'm not seeing any, I'm not hearing any, so we will move on. So now we're going to talk about each part of Medicare, and we're going to start with Medicare Part A. Medicare Part A, things to take into consideration and things to know. If you are already collecting a Social Security income for any reason of any kind, whether it's early retirement income, disability income, or just simply retirement income, if you're collecting any sort of Social Security income when you become eligible for Medicare, regardless of age, you will automatically be enrolled in Medicare, and they will automatically start deducting the premium for Medicare from that Social Security income the month that it goes into effect. If you're not collecting a Social Security income when you become eligible for Medicare at age 65 or what have you, you will not be automatically enrolled in Medicare, and it will become your responsibility to contact Social Security if you want to be enrolled in Medicare at that time. If you do not contact Social Security when you first become eligible, you are not going to be enrolled. If you are going to continue to be working, actively employed, and have employer health insurance through that work, You can delay, again, enrollment into Medicare. That's the special enrollment period option until that work ends. And then again, you have that 8-month window to enroll in Medicare once that employment ends. Or you can enroll in Medicare anytime while you are still actively working. When you quit working and go to enroll in Medicare, they are going to ask that you have a form filled out from the employer that basically proves that you had employer health coverage through that active employment, and that's why you didn't enroll in Medicare. You do not need to contact them prior to that. They do not have really the ability to record the fact that you're not going to take Medicare at first eligibility because of work. So you don't have to worry about letting them know you're not going to take Medicare, but you do have to have a form filled out by the employer that proves that you had employment with health coverage when you go to enroll in Medicare down the road. If you're unable to provide that, or that is not the reason you didn't enroll in Medicare when you first became eligible, again, you could be looking at potential late enrollment penalties, and we will talk about how that works. For most people, and anybody who has worked and paid into the tax system in this country, you should be entitled to Part A of Medicare at no cost or no premium. In order to be eligible for Medicare Part A at no cost, you would have to have accumulated a total of what is called work quarters or work credits. You would accumulate a total of 40 work credits, which is the equivalent of a total of 10 years of work history. That 10 years of work history can be accumulated at any point over your entire lifetime. So if you only worked part-time jobs intermittently, once you have a total of 10 years worth of part-time work, you will have earned your 40 quarters and be entitled to Part A at no cost when you become eligible for Medicare. If you worked from the time you were a teenager until now, that first 10 years of work history, you accumulated your 40 quarters, you earned Part A way back when, and that stuck with you. For those that may not have that 10 years worth of work history, you were a stay-at-home parent or something like that, you do have the ability to purchase Medicare Part A if you don't have enough work quarters, but it can be rather expensive. Medicare Part A this year can be as high as $506 a month just for that benefit. If you were married or a stay-at-home parent with a spouse who worked, and you were married for at least 10 years, you could potentially earn Medicare Part A at no cost through that spouse's work history. But again, you'd have to have at least 10 years worth of marriage to qualify for that. And that would be something that had to be determined by Social Security directly. If you're not sure if you have enough work quarters, again, you'd have to contact Social Security directly and let them tell you. That is also information that you could get automatically through a Social Security personal account. So what does Medicare Part A cover? So the best rule of thumb for Medicare is Part A is for inpatient services, Part B is for outpatient services. Medicare Part A is primarily going to cover inpatient hospitalizations. And under that benefit, anytime you were admitted as an inpatient to a hospital for whatever reason, Medicare Part A will cover the entire cost of that hospitalization except for a deductible. This year, that deductible is a even $1,600, and it is applied per admission, not per year, but per hospital admission. So potentially, if you have multiple hospitalizations in a year, that deductible could be applied multiple times. Outside of that deductible, again, Medicare covers any and all costs while you're inpatient in the hospital. So whether it's a $5,000 inpatient stay or a $500,000 inpatient stay, Medicare Part A covers all of it minus the deductible. And that covers you up to 60 consecutive days in the hospital. That would be obviously a worst case scenario to be in the hospital for longer than a few days. But it does cover you up to 60 consecutive days. If you're for some reason in the hospital for more than 60 consecutive days, Starting at day 61, Medicare will continue to pay for that hospitalization, but they will start applying a daily coinsurance. That means they will continue to pay everything per day for that hospitalization, except for this year, $400 a day starting at day 61. And that would be your benefit for the next 30 days. If you're there longer than 90 days, consecutive days, that coinsurance that Medicare will not pay goes up to $800. And after 90 days, you start going into your lifetime reserve days. So Medicare provides a total of 60 lifetime reserve days that are applied to any hospitalization over day 90, consecutive day stay. You would have to have at least 60 days from the time you are discharged from a hospital to the time you may be readmitted to the hospital as an inpatient before you would start a new benefit period. And a benefit period for this benefit is designed as 90 days. So any inpatient hospitalization you have from the day you're admitted up to 90 days is a benefit period. And you'd have to have at least 60 days from discharge and readmission before a new benefit period would start and a new deductible could be applied. There's also a rule that surrounds qualifying for inpatient skilled facility stay, but we'll cover that in a second. Medicare also pays for inpatient psychiatric hospitalization. Same rules. They cover everything minus an inpatient deductible of $1,600 this year. But Medicare does put a lifetime maximum amount of days that they will pay for inpatient psychiatric hospitalization at 190 days. There is no limit for medical hospitalizations. They will pay for inpatient hospital stays as often as you may need them. But again, there's a 190-day lifetime max for psychiatric hospitalizations. While you're inpatient in the hospital, Medicare Part A covers everything. Covers medications, room, board, whatever medical services you need, whether it be surgery or, whatever. Everything is going to be covered that is medically necessary. Things that would not be covered under Part A while you're in the hospital. Typically, you're not going to be able to get a private room unless it's deemed medically necessary and ordered by your doctor. No part of Medicare covers any of the first 3 pints of blood you might need replaced. Medicare Part A also would not cover private duty nurses while you're in the hospital or room sitters. And it would not cover what they consider self-administered drugs while you're in the hospital. Any drugs that you get while you're inpatient in the hospital are going to be covered as part of your benefit. Self-administered drugs would come into play typically on the day of discharge. On the day of discharge, you're no longer considered inpatient. And so if it's taking an extended amount of time for you to be discharged from a hospital, and in the meantime, it becomes time for you to get your maintenance medications, for example, and a nurse comes in and hands you a cup of pills, your maintenance meds, and you take that cup and you swallow those pills on the day of discharge, you have just self-administered medications, and you could be privately billed for that. It would not be part of your Part A benefit. Outside of those few limits, again, most services that you would need while you're inpatient are going to be covered. Medicare Part A also covers skilled nursing facility care, typically going to be something you would look at discharge from an inpatient hospital stay. And typically you'd go to a skilled nursing facility after hospitalization for rehab or recovery. Medicare does require that you are an inpatient in a hospital for at least 3 consecutive days prior to being discharged to a skilled facility for rehab or recovery. If you don't have at least 3 days as an inpatient, and that's 3 full days as an inpatient prior to being discharged into a skilled facility, Medicare will not pay for that skilled facility stay. But if you have that 3-day eligibility requirement met, and you're discharged to a skilled facility for rehab or recovery, Medicare will pay 100% for the first 20 days of that skilled facility stay and all the services that you receive. If you are in that skilled facility for longer than 20 days, Medicare Part A will again continue to pay for that stay, but they will start applying a coinsurance, a daily coinsurance. In 2023, that daily coinsurance is a flat $200 per day. So Medicare pays 100% for the first 20 days of a skilled stay, starting at day 21 and up to day 100 in a skilled facility. Medicare will continue to pay everything except for that $200 per day. Medicare pays all or part of up to 100 days at a time. That is a benefit period for skilled facility care. If you are still in a skilled facility after 100 days, so starting at day 101, and you are still unable to go home, even if you're discharged home with continued rehab care at home or what have you, if you have not gotten well enough to be able to go home, even with extra help at home, Medicare no longer cares why you're in that skilled facility because your stay has just become custodial or long-term. Medicare puts a 100-day limit per rehab stay or skilled facility stay because they have determined that if you have not gotten well enough after 100 days to go home, the likelihood of you being able to go home becomes pretty slim. And at that point, it becomes custodial or long-term care, and Medicare does not pay for custodial or long-term care. The key to Medicare benefits is that any service that Medicare covers has to be considered medically necessary. Custodial or long-term care is not considered medically necessary. So at day 101, you are looking at Medicare benefits cutting off completely, and you'd have about 3 options to continue your care at that facility. You could either privately pay out of pocket. You may have purchased long-term care insurance to help cover the cost of that stay in this situation, or you may qualify for Medicaid, long-term care Medicaid. But again, Medicare covers up to 100 days. These are consecutive days at a time. That 100 days is a benefit period. Again, you would have to have at least 60 days between the time you're discharged from a facility to the time you're readmitted before a new benefit period would start. And you would get another 20 days at 100% coverage, so on and so forth. If you're discharged from a skilled facility and readmitted within 60 days, when you go back into that facility, you may still be in the same benefit period you left with. So if you spent 30 days in a facility, they discharged you home, you were home for 2 weeks and then had to go back in. When you go back in, you're going to be starting day 31 of that same benefit period. Medicare will provide you with an unlimited number of these benefit periods. There is no limit to how often you can use that benefit if you need it. The last benefits available under Medicare Part A are going to be home health care and hospice. Both of those benefits do require that a doctor certify eligibility for you to receive them and continue to certify your eligibility, telling Medicare that you meet the medical criteria for those benefits every 60 to 90 days. If the doctor does that and you qualify for those benefits and receive them, typically those services will be covered at 100%. So if it's home care, once you're discharged from the hospital and go home, Medicare will pay for medical personnel to come in and do wound care or therapy or, medically necessary services like that. What this benefit is not going to pay for under Medicare Part A are going to be homemaker services. So it's not going to allow someone to come in and help you with light housekeeping or help you with meal prep or anything like that. It's only going to pay for medical personnel to come in and provide medical services in the home. Under the hospice benefit, if you qualify for hospice, which typically means that you are in an end-of-life situation, Medicare will pay for any service that will make you comfortable in an end-of-life scenario. So it will pay for medications to make you comfortable. It will pay for counseling services or social services. It will pay for, you know, medical supplies or anything like that, anything that's going to make you comfortable. It will not pay for any service that is going to be designed to improve your medical condition or your health. In a hospice situation, you have accepted the fact that you are potentially in a scenario where you have 6 months or less to live. That does not mean that there is a limit to how much or how long Medicare Part A covers hospice care. There is no limit to how long you can be on hospice as long as you continue to meet the eligibility criteria as certified by your doctor. So there are very, very few limits to these two benefits, or as far as how long you can receive them under Medicare Part A, as long as the doctor, again, continues to certify your eligibility, you can continue to receive those services for as long as you need them. So that is Part A in a nutshell. Any questions about any of that? Again, if you have a question, you can unmute and ask, or raise your hand, or type into the chat. All right, not hearing any, not seeing any questions. We are going to move on to Medicare Part B. So Medicare Part A covers your inpatient services. Medicare Part B is basically going to cover your outpatient needs. Again, things taken into consideration: if you're collecting Social Security income, you will automatically be enrolled in Medicare A and B. If you are actively employed with health coverage, you can delay enrollment into A and B in favor of that employment and then enroll when you quit working. That includes a spouse as well. So if you have a spouse who is covered under your employer health benefit, that becomes eligible for Medicare as long as you continue to insure that spouse through the employment health insurance. That spouse can also delay enrollment into Medicare until that employment ends. For Medicare Part B is the part of Medicare everybody has to pay for. Very few people get out of having to pay Medicare Part B premiums. However, that premium can vary from person to person depending on income, so it's means tested now. Things to think about when you are becoming eligible for Medicare and whether or not you want to enroll in A or B or both. There are some situations or some insurance situations that would require that you be enrolled in both A and B of Medicare in order to have other types of medical coverage. So if you wanted to purchase a Medigap policy to go with Medicare, you have to have both A and B. If you want to enroll in an Advantage plan when you become eligible for Medicare, you have to be enrolled in both A and B. If you are retired military and you're not actively employed with health coverage and you want to continue your TRICARE benefits, you are required to enroll in A and B of Medicare. At that point, your TRICARE turns into TRICARE for life and coordinates as secondary to Medicare. But unless you're actively working with employer coverage, you do have to enroll in Medicare when you become eligible in order to keep TRICARE. I also get a lot of questions from veterans who access most of their health care through the VA system as to whether or not they need a Medicare. If they get all of their health care needs met through the VA system, why would they want to enroll in something they have to pay for like Medicare Part B? Which is a perfectly valid question, but there are consequences. So the VA health system is not considered insurance. First of all, it is a health system, but it's not health insurance, and it's not active employment. So if you don't enroll in Medicare when you become eligible because you use the VA system, and for some reason down the road, you may need to enroll in Medicare because VA is maybe not as easily accessible as it used to be, you'd be allowed to enroll during a general enrollment period, but you would be looking at paying penalty for not having enrolled sooner. Again, the only excuse Social Security accepts for not enrolling during your initial enrollment window is active employment with health coverage. VA does not fall under that exception. You can have VA and Medicare, and there are advantages to having both. In El Paso County in particular, VA medical systems and programs are somewhat readily available, but that's not the case everywhere. Whereas Medicare benefits are good anywhere in this country with any provider that accepts them for any medically necessary need, no questions asked. So if you use the VA for most of your healthcare needs, that's great. But it's nice to know that you have Medicare for anything that ever comes up at any time, anywhere. VA health systems will typically provide care for VA-related needs. Medicare will provide care for anything and everything. So it's nice to have that backup. It's nice to know that if you go out of state or out of town to visit family or whatever, and you're in a medical need, and there's not a VA facility anywhere around, it's nice to know you have Medicare that will cover whatever you need. So again, you're not required to enroll in Part B. Nobody is required to enroll in any part of Medicare, quite frankly. But there are advantages to having Medicare A and B, even if you access the VA system. Again, and I keep hammering this point in, if you're actively working, you have health coverage through that work, you can delay until you quit working. Then you get that special 8-month special enrollment period to enroll in Medicare without penalty when that work ends. If you don't fall under that special enrollment period, you did enroll during your initial enrollment window, again, you can enroll any year down the road during the general enrollment period, January 1st through March 31st, but you would be likely looking at a penalty, and this is where that comes in. So for most people, the Medicare Part B premium for 2023 is going to be $164.90 per month. And if you're collecting a Social Security income, that amount will be deducted automatically every month. If you're not collecting a Social Security income, you're going to wait for full retirement age or whatever, you will be billed directly for that premium. And you can either pay it quarterly or you can have it electronically deducted from a bank account. We're going to talk about the means testing, meaning you may pay a higher premium if you have a higher income in a second. If you are imposed a penalty because you did not enroll under your initial enrollment or a special enrollment, the way the penalty is calculated, and it usually only applies to Part B because most of us get Part A at no cost. If you have incurred a penalty for Medicare Part B, that penalty is going to be 10% of the Medicare Part B premium for every full 12-month period that you are not enrolled but could have been. And that's going to accumulate over time. So if you wait 3 years to enroll in Medicare and you did not have active employment with health insurance, you're looking at a 3 years times 10%, so a 30% penalty. That 30% will be multiplied by the premium, the base premium, the year that you enroll. So if you could have enrolled 3 years ago, you're enrolling this year, that 30% would be multiplied by $164.90. Whatever that comes out to is going to be tacked on top of the $164.90 every month forever. Medicare penalties last forever and they're added every month. So the longer you wait to enroll in Medicare, the higher penalty you're going to pay. Even if you only get a 10% penalty, that 10% or $16 or $17 is going to be tacked on top of your monthly premium every month forever. And it doesn't sound like much now, but after 20 years, that adds up to quite a bit. So if you can avoid incurring penalties for Medicare premiums, that is going to be my best advice always. But if you do incur penalties, it is, again, for every 12 full months you don't have Medicare and could have had it, and it's forever. Medicare Part B benefits does have a deductible, but for Part B, deductible is an annual, one-time-a-year deductible, and it's a drop in the bucket, $226 this year. Once you've met that deductible, meaning Medicare will not pay any of the first $226 for medical services that you may need. Once you have met that deductible, Medicare pays most Part B services at an 80-20 split. So they pay 80% of what they allow for a service and leave a 20% balance. I mentioned a minute ago that Medicare premiums are means tested, meaning the more income you have, the higher premium you may pay. Means testing premiums are going to be based on the most recent complete tax filing that the IRS can provide to Social Security, which means they're going to be looking at old information. So we are in 2023. If you're lucky, you've completed your taxes for 2022. They're going to be looking at your 2022 income and applying any means test to your Part B premium in 2023. On the plus side, they do review that information every year. So if your income is higher in 2022 than it is in 2023, you may pay a higher premium in 2023, but when they look at it again in 23 for 24, that premium could go down. The income thresholds for a single person start at least $97,000 a year. $194,000 for a married couple. If you're below that threshold, you're going to pay the $164.90 a month. But if you go above that threshold, then I've listed the premiums that you would pay based on the different income brackets. But again, keep in mind, even if you are imposed a penalty initially, if your income changes down the road, because they review that information annually, you're not going to be stuck paying a higher premium forever. All right, so what services does Medicare Part B cover? Again, basically Part B is going to be for all your outpatient needs. So it's going to cover any and all doctor's visits. It's going to cover all your x-ray and lab. It covers medical, surgical, and anesthesia services. Medicare does pay for medical second opinions. I mentioned Medicare. No part of Medicare covers any of the first 3 pints of blood you may need replaced, but Medicare Part B will start paying for blood at pint number 4. Medicare Part B covers your emergency ambulance rides. Has to be considered a medical emergency. Covers all your annual vaccines, such as the flu shot, the pneumonia shot, hepatitis, the shingles vaccine. Although Part B only covers the administration of the shingles vaccine, Part D would cover the actual vaccine itself. Part B also covers all your physical, occupational, and speech therapies, provides coverage for durable medical equipment such as oxygen concentrators, walkers, wheelchairs, in-home hospital beds. And there is limited coverage for other services such as podiatry or optometry, chiropractic, those kinds of things. So basically, again, it's going to be all your outpatient needs. Things that are not going to be covered under Medicare Part B: routine physicals, routine foot care. Medicare does not pay for hearing aids or the fitting of them. Medicare does not pay for routine eye exams or the glasses associated with them. And even in a medically necessary eye visit, Medicare does not pay for the refraction of your eyes. Currently, Medicare does not cover dental in any way, shape, or form, nor does it cover cosmetic surgery because that would not be considered medically necessary. Now, having said all that, a lot of these services that Medicare does not pay for because they are considered routine have probably been reclassified as preventive. So Medicare does not pay for routine needs, but they do cover preventive needs. So preventive services became the big thing several years ago, and Medicare jumped on that bandwagon with both feet and covers many, many, many preventive services. However, Medicare still will not pay for a routine annual physical. Most people think of a routine annual physical as going to the doctor's office and getting blood work and having to get up on the treadmill and all that kind of stuff. Medicare doesn't pay for that. What Medicare will pay for is what they call a Welcome to Medicare preventive visit. Basically, it's a use it or lose it benefit. So you have 12 months from the time Medicare kicks in to use the Welcome to Medicare preventive visit service. But that visit is simply an in-depth conversation with your doctor. And during that conversation, that doctor is going to ask you about your medical history, your family's medical history, your social history, your mental health history, all of those kinds of things to establish a baseline. And it's going to give them an opportunity to perhaps suggest any preventive services that might be of benefit to you. Whether or not you take advantage of that Welcome to Medicare preventive visit, you would still have access thereafter for an annual wellness review. Again, that's simply going to be an in-depth conversation with your doctor about the previous year's medical situation, your social health, your mental health, your physical health. And it will provide an opportunity for them to potentially suggest preventive screenings or services for you to take advantage of. Medicare covers a lot of preventive services. And as of 2020, Medicare pays for all preventive care at 100%. I've listed just a very, very short list of some of the preventive services Medicare will pay for. If you would like a complete listing of any preventive and all preventive services Medicare does pay for, the best resource for that would be the Medicare and You Handbook, which is mailed automatically to everybody with Medicare every year, usually around September, except for the year you enroll in Medicare. So anybody who's becoming eligible for Medicare this year or is going to enroll this year probably won't get one in the mail this year, but you'll get one every year thereafter. You can always go online to the Medicare.gov website and view the Medicare New Handbook for this year as a PDF. You can download it. You can call 1-800-Medicare and ask them to mail you a hard copy. And you want to ask them to mail you a hard copy specific to your state. In that Medicare New Handbook, there is about a 30-page section that goes in detail about what Medicare preventive services are covered. Tells you the service, the eligibility to qualify for that service, how often you can receive that service. Anything described in that section as a preventive service will also be indicated by a little blue apple symbol next to that description. So obviously Medicare encourages people to take advantage of these preventive services to try and detect any health issues before they develop into something more serious. And I think that's the gist of Medicare Part B. Any questions about any of that? You guys are either taking really good notes or you're not going to be ready for the test I'm going to give at the end of this. Just kidding. All right, so no questions, so we'll move on. We're almost done. So there is financial assistance available to help cover some of these costs, excuse me, that are left over or incurred for Medicare. And for A and B services, that program is called Medicare Savings Program, or MSP. MSP programs can potentially help pay your Medicare Part B premium. And if your income and asset level is low enough, it could also cover your Medicare deductibles and the 20% coinsurances that Medicare leaves over. If you are eligible for, apply for, and are approved for a Medicare Savings Program to get that assistance with those costs, you also automatically become eligible for assistance with Medicare drug costs. But you have to apply for those benefits. They're not automatic. In most states, to apply for Medicare savings programs, which are a federally funded program, this is a federal program specific to people with Medicare, and it specifically covers Medicare expenses. But to apply for it, you typically have to go to your local Department of Human Services and do a Medicaid application. Government has simply found that that's the easiest way to apply for such a program and to keep track of people who are eligible for such a program. And basically it makes sense because if you apply for this program and are approved, what that means is the state is going to tell Social Security that the state is going to pay your Medicare premium so that Social Security does not take it out of your check every month. And then the state gets reimbursed by the federal government. If you are already on some other types of programs, such as SSI or Supplemental Security Income, or if you're on old age pension program or OAP through the Medicaid system, or if you have a long-term care Medicaid assistance, you automatically will get this extra help for your Medicare costs. Otherwise, again, you must apply for and be approved for it. And of course, with all financial assistance programs, it's going to be based on income and asset limits. For 2023, here are the limits for both a single person and a married couple. These amounts are in monthly income and they're in gross dollars, so pre-deduction monthly incomes from any and all sources, including Social Security. And it has asset limits. Assets are going to be considered financial accounts, checking, savings, etc. Property that you don't live on, excess vehicles. Everybody's allowed to have a primary vehicle, that doesn't count, but more than one vehicle per person is going to be considered an asset, those kinds of things. For the asset levels, you can also add $1,500 to that amount if you have any sort of pre-burial arrangement, whether it be a life insurance policy or, a burial arrangement through a funeral home or something like that. You can up that asset limit, but you do have to prove it. If anybody has questions about this program or knows someone who might qualify for it, we do help with these applications, and we're always happy to sit down and talk to somebody about their eligibility and assist them in applying if it appears they are eligible. So we try and make it as easy as possible for people to get this help if they need it. And that's about all I have for you. So again, if you have additional questions after this presentation, you are always welcome to contact your local SHIP office. That's us here in Colorado Springs. But again, this Colorado Springs SHIP program covers a total of 9 counties in Colorado. We can be reached in our 9 counties through our local Colorado Springs number, or here's the statewide toll-free number. If you dial that number from anywhere in the state, you will automatically be routed to the SHIP program closest to where you're calling from. Because again, every county of every state has a SHIP program for people to access for free advice and assistance with Medicare. If you want more information about this program in general, you can go to the SHIP TA Center. It's shiptacenter.org, and it gives you much more information about this program, what it does, why it exists, etc. You will also get a survey probably tomorrow via email. That survey could either be our internal AAA survey, or it may be the national CMS and ACL survey. That is going to simply ask you if you attended a SHIP-sponsored presentation, such as this, and if you found that information useful. Answering the questions in these surveys, especially the national survey, does greatly help us continue this program by continuing our funding. This is a federally funded program, so we do not charge for our services. We do not endorse any specific insurance companies, products, or organizations. We are true consumer advocates that are here simply to educate and assist. The SHIP program also has a sister program called Senior Medicare Patrol, or SMP. This program is designed to help educate and assist and empower people on how to detect, protect, and report Medicare and Medicaid fraud and abuse. This program is also federally funded. Services are provided at no cost, and it is primarily volunteer run because it gets even less funding than the SHIP program does. So anybody who's interested in volunteer opportunities, both of these programs have volunteer opportunities, and we'd love to talk to you. Which is why I included a handout about volunteering for these programs in the email that I sent you. Volunteering for the SMP program is probably the more entertaining volunteer opportunity, but both opportunities can be very rewarding because you are required to gain a high level of knowledge through training to volunteer to help people with these services. So if anybody is interested or wants more information, please contact me. I've provided my direct extension here on the slide and on the handout. And that is it for the evening. I did pretty good on time. Any questions before I let you guys go for the night? Thank you for the comment. And yes, you are welcome to contact us at any time. Your best bet to contact me is through email at seniorinsure@ppacg.org. But you're welcome to call us as well at any time at our local Colorado Springs office. Numbers provided are toll-free statewide number. I have a total of 4 additional full-time counselors and 2 part-time volunteer counselors. So someone should be able to assist you with any questions if you call us. Again, if you want to reach me directly, send me an email at seniorinsure. And I'm happy to respond usually within 24 hours. If you try and leave me a message, it could take me 2 weeks. But always happy to talk to anybody about any questions you may have. So happy to help with any information that we can help with. And I think that's it. So if I don't hear any other questions or see any other comments, I will let you all go. And I will hope to see you next week when we talk about Medicare supplements and Medicare Advantage plans in detail. If you have any questions in the meantime, give us a call or shoot me an email. I appreciate you attending this evening's presentation. I hope you found it useful. And with that, I will say good night. Thank you so much.